Hello, and welcome to the All Things ADHD podcast from CHADD's National Resource Center on ADHD.
Welcome to All Things ADHD. My name is Sarah Bowser, and I'm the Adult and Educator Training Manager for CHADD. In today's podcast, we will discuss understanding stimulant misuse among college students. Here to help us understand this topic is Dr. Kevin Anschel, a licensed psychologist and professor of psychology at Syracuse University. Welcome, Kevin. Could you tell us a little bit about yourself?
Thank you for the invitation to participate. I'm really glad to be here today. I'm a professor of psychology at Syracuse University. I've been a licensed psychologist for nearly 25 years. Most of my clinical work and all of my research really focuses on ADHD. I was originally trained as a child psychologist, but as my patients got older and older, I eventually gravitated more towards working with teens and adults. And now most of my research and clinical practice is focused on college-age students with ADHD.
All right. So one of our first questions is, what are the reasons college students misuse stimulant medications?
Probably the first thing that would be important for your audience to understand is that the non-medical use or the misuse of stimulant medication, really the rate of that really peaks in the 18 to 25-year-olds. And so this is the most common amongst the 18 to 25-year-olds. College students often report that obtaining a stimulant medication is, quote, easy. And it's often acquired without paying. And when it is purchased, the cost is usually low. The three primary motives that are often cited by college students for misusing a stimulant are, number one, is really academic. Number two is recreational. And number three is weight loss. Okay. And so let me take your audience through those three primary motives. The first one's academic, that academic motivations are cited by anywhere from 50 to 90% of college students who report the non-medical use of stimulants. And they are the most commonly noted motivation in almost every single study that's been done on college students. And as I'm going to get to a little bit later in this podcast, but I'm going to alert your audience right now that there actually is an inverse correlation between grade point average and non-medical use, that the higher your grade point average, the less likely you are to misuse a stimulant. And the longitudinal data actually showed that academic difficulties lead to non-medical use of stimulants as the students are trying to keep up academically. So the primary motive for sure is one of academic. Number two are the recreational motivations, and these are more of your typical substance use or substance misuse types of motives, and it includes enhancing the effects of alcohol, being able to enhance social situations, and helping the students to stay out later in order to be able to party more. The third one is more specific, especially to college females. And the third primary motivation for stimulant misuse in college students is, again, it's more specific to females, and that's one of weight loss because of the appetite suppressant qualities that most of the stimulant medications have. But I'll conclude this very long response by saying, overwhelmingly, the primary motive is academically driven.
Okay. Are there specific groups of college students who are more likely to misuse stimulant medications? And if so, why?
Yes. And so most college students who report the non-medical use of a stimulant will report that they got the medication from a college peer who had either a prescription for a stimulant or had the stimulant themselves. So a high-risk group are those that have access to peers who either have an ADHD diagnosis and associated stimulant, or others who may have access to a stimulant. And so access is definitely consistently noted as a high risk. Other consistently noted high risk for non-medical use are being a white male who is involved in the Greek system in a fraternity and who also report higher levels of other substance use, especially cannabis and alcohol. And so being a white male in the Greek system who's also reporting high levels of substance use, that package is a particularly high risk for the misuse of stimulants. And also, individuals who report non-medical use of stimulants also report higher levels of ADHD than those who do not engage in the non-medical use. And so students who report high levels of ADHD, but not necessarily an ADHD diagnosis, are another higher risk group.
In recent years, there have been instances of students and others seeking stimulants, and they end up buying drugs labeled as Adderall or other stimulants that are either fake or mislabeled. Are students aware of the dangers of counterfeit drugs?
My own intuition on this, I'm around college students. I'm on a college student campus, I'm on a college campus and surrounded by college students. And that's all that I see clinically really right now. I would say that the awareness is definitely there, that the awareness is there. What I think is relatively unique to the misuse of stimulants is that students are maybe more likely to illegally use a stimulant in comparison to other drugs because they can obtain the stimulant from a friend. And I think this is really probably the most critical aspect here. And so they get it from a person they know, and it raises less concerns about the drug being cut with other substances. But you are correct that fake, mislabeled, and counterfeit drugs are certainly out there. And these counterfeit drugs can contain fentanyl. And in fact, a major driving force behind the epidemic of fentanyl here is the production of counterfeit prescription pharmaceuticals. And so I think the awareness is there, but my own experience, as well as what data would suggest, is that people view the stimulants and other prescription medications that they get from a peer somewhat differently than maybe getting this from a stranger. But unfortunately, obtaining it from a peer who you don't really know where that peer got the medication from, that is not a great risk reduction strategy.
Okay. Have there been any successful programs or tactics for reducing medication misuse among college students?
Yeah. So there are for sure a number of different approaches that you could take here. And it really depends on who is the misusing student. And so have there been any successful programs? That one, I think I'm going to be more muted in saying we have some data suggesting some things can help. Would I recommend them in a blanket way as being universally successful for students? I would not. So, for example, an approach that a lot of people in the ADHD field are working on now is trying to reduce the diversion of the stimulants. So, as I mentioned before, most individuals who report the non-medical use of the stimulant will also report that they got the medication from a college peer, often one who has ADHD and a prescription. And so the risk reduction intervention here is targeting the students with ADHD and those that are at risk for diversion. And this group absolutely needs to be targeted. I think the best known of the diversion reduction strategies has been developed by Dr. Brooke Molina at the University of Pittsburgh. And her approach really works a lot with the physicians and how to educate the physicians on how to have these conversations with the high school students before they leave the home. And so in her approach, the physicians and also the parents, but more so the physicians, are really the key figures who can successfully empower the students with ADHD not to share their medication. And again, her program, they have reported some very optimistic preliminary data. On the other hand, there is a smaller subset of people who report non-medical use of stimulants as those who have ADHD and they're misusing their own prescription stimulant. And so to be able to have any successful tactic or program for reducing medication misuse here, we have to really understand the motives. For example, if the motives are primarily academically oriented, then having some conversation with the student around study strategies or kind of interventions that might help them academically. On the other hand, if the primary motive for misusing their stimulant is somehow related to recreational use or drug use, then a lot of the interventions that we typically use for substance use can be helpful and can lead to more targeted programming here. I think the last one really is that there is a group of individuals who are able to fake ADHD and they're able to receive a prescription from their healthcare provider. And so the approach really here for reducing the stimulant misuse is to target the prescribers and to educate the prescribers on how best to consider the possibility of malingering or non-credible reporting from their patient who may be attempting to access the stimulant for secondary gain. So again, there have been some programs and tactics that have been developed, and they haven't really gained universal acceptance. And so they're not used really across the country yet, unfortunately.
Okay, so you had mentioned that the successful program was with the medical provider speaking to the students that they are prescribing to. Is there any success, or are there any programs in place for the universities to talk to students about this? And is that successful?
Yes, for sure. The universities are definitely concerned about this. And so the universities are attempting to educate their students about this. For example, this type of information can be included in the orientation, the orientation materials or orientation programming that the students complete usually in June, July, or August before their first year on campus. Also, once the student is on the campus, the colleges and universities are really ranging in their approach from simple education and awareness to also harm reduction strategies. And so the colleges, I think, are on board with this as being an increasing issue. I think if you had asked me this question maybe 10 years ago, I would say there still is a limited awareness and acknowledgement of this. But I think the colleges themselves have become more proactive about this issue on their campus.
Well, that's good to hear. Have families, universities, and providers been open to incorporating principles of harm reduction when responding to medication misuse on college campuses?
Harm reduction, to me, is really an approach that accepts that the behaviors, such as the substance misuse, are inevitable. And so, in my experience, in my opinion, I think the universities and providers are more open to harm reduction strategies than parents. A zero tolerance approach is really not enough. It isn't sufficient. And there are lots and lots of research studies and data that suggest that strategies that encourage a zero tolerance approach to substance use in college students really have little impact on curbing the type of behavior you're concerned about. And so within the last 5 to 7 years, maybe harm reduction strategies have become increasingly common on college campuses. And also providers are increasingly engaged in harm reduction discussions around the misuse of medication. I should say it isn't just the stimulants. There's probably much more conversation on college campuses around the misuse of opioids. But I can say that the use of stimulants is included in those harm reduction conversations with providers and campus. Parents, on the other hand, in my experience, as well as what the research data would suggest, tend to be less enthusiastic about harm reduction approaches when talking about their young adult and substance use. And I'm a parent too. I actually have 2 college students. And so I absolutely can empathize where the parents are coming from. I know having that conversation can be difficult. On the other hand, I would encourage the parents in your audience listening to consider the relatively universality of college students experimenting with substances during their time in college. And so a zero tolerance approach as a parent, even though that's what your instinct may say, is less likely to be effective than taking a approach that is more understanding and accepting that this is something that your college student may experiment with.
Okay. What advice do you have for college students who are misusing stimulant medication or those who know such a student? Where can they get resources?
Yeah. And so, although improving academic performance is the number one motivation for non-medical use of stimulant non-medical use has not been shown in any study to improve academic performance in those without a diagnosis of ADHD. It helps people with ADHD. If you don't have ADHD and you're using a stimulant and your goal is solely to improve your GPA, the data suggests that does not work. For example, in a 2-year study of almost 900 undergraduates without ADHD, grade point averages significantly increased across the 2 years for students who engaged in no misuse. The students who engaged in misuse, their GPAs dropped. And so we know the data and high quality research data suggests that even though the students perceive it to be an academic steroid, it is not. Rather, much research has suggested that the power of expectancy drives these reported benefits, much like a placebo effect. If the students expect the stimulant to do something, then they report what they believed has happened, and it is largely based upon that expectancy, right? And so with regard to college students who are misusing stimulant medications, my advice would be if your number one goal for doing this is to improve your grade point average, you should know that that's probably not going to happen. And so challenge these expectancies. And, I would want those college students to be much better informed about these outcomes that are associated with non-medical use. In addition, I would also want these college students to become much better educated about the true prevalence of misuse of stimulants. Lots of data suggest if you ask the average college student what percentage of peers on this campus are misusing stimulants, you get numbers that are always north of 50%. The true prevalence of non-medical use is under 20%. And so college students overestimate the prevalence of the misuse in their peers, which unfortunately may serve to normalize the behavior and make them more likely to engage in the non-medical use. Simply put, everyone is not doing it. And so I think those would be probably the advice that I would have for college students who are misusing it, is to understand what the data suggests and not overestimate the number of your peers. Where can they get resources? College student health centers are very aware of this issue on college campuses. They are well positioned to be able to make referrals to appropriate campus level resources that are there. As I alluded to, there are a number of colleges that are adopting harm reduction strategies, again, most aggressively towards the misuse of opioids, but also towards the misuse of stimulants. And so college health centers or college student health centers are well equipped to be able to make referrals to campus resources.
Excellent. Is there anything we haven't covered today that you'd like to add before we conclude?
I'm not sure that I would say that we haven't talked about it, but I would like to double down on it and emphasize it, that these misperceptions that college students have about the level of the use of other students, the ability of the stimulants to improve academic performance, the one I haven't talked about is the safety of the use. And so college students have misperceptions about all of the above. And as I've alluded to, but I want to reiterate, the non-medical use of prescription stimulants is in fact associated with decreased academic performance. And so increasing the awareness of college students of the evidence of the effects of stimulants hopefully will help them, equip them with the knowledge they are required to make informed decisions about use. And if your goal is to improve your GPA, this is not the way to do it.
Awesome. Well, hey, thank you so much for taking the time to explain this topic to us. That was a lot of great information, and we really appreciate you taking the time.
Sure. It was absolutely my pleasure, and thanks for having me.
Thank you for listening to another episode of the All Things ADHD podcast from CHAD's National Resource Center on ADHD.